Everyone, welcome back to Sowkya Vision. Today we are going to discuss hemostasis. What is hemostasis? Hemostasis is defined as arrest of bleeding or stoppage of bleeding from an injured blood vessel. Say, is if there is any injury to the blood vessel, it gets bleeding. After some time, the bleeding gets stopped. Yes, the bleeding gets stopped and clot formation takes place. That process is known as what? Hemostasis. The hemostasis is explained under three main headings: vasoconstriction, platelet plug formation, and clot formation. Whereas vasoconstriction and platelet plug formation are considered as primary clot formation, whereas the clot formation is the secondary one. Yes, first one is these two are the primary plug formation, whereas clot formation is the secondary. Now let's see each one by one. First of all, let's see. Whenever the blood vessel is ruptured, whenever there is an injury to the blood vessel, there will be rupture of endothelium. Yes, the blood vessels are lined by endothelium. There will be rupture of endothelium. Then, the after rupture of endothelium, there will be exposure of collagen. There will be the exposure of the collagen. Yes, that collagen, the platelets get adhered to that. The blood vessels containing blood in which we are containing platelets. Yes, RBC, WBC, platelets. Platelets get adhered to the collagen. That collagen is exposed due to the rupture of endothelium during injury to the blood vessel. So, the process of platelet get adhesion is enhanced by, accelerated by von Willebrand factor. Von Willebrand factor enhances, accelerates the process of platelet adhesion to the collagen. Then when it is adhered to the collagen, the platelets get activated. Yes, after adhere to the collagen, the platelets get activated. Then the first process is what? Vasoconstriction. Immediately after injury to the blood vessel, the vessels get constricted. How? As it is a local phenomenon. It is a local phenomenon. It doesn't involve the surrounding artery surrounding, but it is what it is it is a local phenomenon. It just involves that only particular site. Yes, blood vessels constrict immediately after the blood vessel injury. There will be decreased loss of blood from damaged portion. Why? See, whenever the blood vessel get constricted, the blood loss is decreased. Yes, due to that, to achieve that, the blood vessels get constricted so that the less amount of blood is lost from the body. So how this getting constricted, how the blood vessels are constricted? So the activated platelets are there, no? The activated platelets are releasing serotonin. Yes, serotonin is released by activated protein, activated platelets. So this serotonin causes vasoconstriction. Vasoconstriction lead to decreased loss of blood from the damaged portion. Now, vasoconstriction is least effective during which condition? When the blood vessel is atherosclerotic vessel or large vein. Whereas large vein, it is containing less muscle coat, so it takes time. It takes the vasoconstriction is least effective there at large veins. Yes, now let's see platelet plug formation. Platelet plug formation, it is not permanent, but it is a transient. It cannot stop bleeding for a long time. It is not that effective than the clot formation. It is just a transient. So platelet adhesion to the collagen, we see that the platelet get attached to the collagen, then it secretes ADP. What is ADP? Adenosine diphosphate and thromboxane A2. It secretes adenosine diphosphate and the thromboxane A2 that attracts even more and more platelets and activate them. Whenever the ADP and thromboxane A2 are released, they attract even more and more platelets and activate them. That leads to their adhesion, aggregation of the platelets together. Whenever they are more activated platelets, they get adhered to each other, forming a temporary platelet plug. a temporary platelet plug is formed that closes rupture blood vessel. That closes, see, this is the blood vessel, here the injury. Yes, so all the platelets get activated and adhere to each other and travel here and closes the ruptured blood vessel. Yes, this is temporary, so it cannot stop the bleeding for a long time. Yes, it closes blood vessel and prevents further bleeding, so it cannot stop bleeding for the long time. For the stoppage of complete stoppage of bleeding, we need some factors known as coagulation factors, blood coagulating factors. They are known as clotting factors. Yes, coagulation is what? It is the third step. It is a process by which blood loses its fluidity. Yes, blood loses its fluidity, so the it becomes nothing but jelly like mass known as clot, known as clot. So the clotting factors are what? It is, there are 13 clotting factors, in which the sixth one is not yet named. So the first one is fibrinogen, prothrombin, thromboplastin, calcium, labile factor, factor 7 is stable factor, eighth one is anti-hemophilic factor, Christmas factor, Stott power factor, and plasma thromboplastin antecedent, plasma thromboplastin antecedent, Hagman factor, fibrin stabilizing factor. These are the 13 factors. These are the 13 clotting factors that helps in the coagulation of blood. So what is coagulation? Coagulation is nothing but the process by which blood loses its fluidity and becomes jelly like mass known as clotting. Now let's see the coagulation. Now let's see the blood coagulation. Yes, so here we go. What is blood coagulation? As I said, it is nothing but the loss of fluidity and becoming jelly like mass known as clot. So the blood coagulation takes place under three main headings. What are they? Formation of prothrombin activator, that in turn activates prothrombin to thrombin and fibrinogen to fibrin. These are the three main stages that are going to take place in the blood coagulation. Yes, now the process by which prothrombin activator is formed by two main pathways, intrinsic pathway and extrinsic pathway. If there is injury to the blood vessel, the intrinsic pathway is activated. Yes, intrinsic pathway is activated. So the factor 12 is firstly going to come into act. The factor 12 is coming to act first in the presence of what? Kallikrein. Yes, kallikrein and high molecular weight kinogen. In the presence of these, the factor 12 is get activated. Yes, the factor 12 is get activated, in turn which activates the factor 11 in the presence of high molecular weight kinogen. Now the activated factor 11 activates the factor 9 in the presence of calcium and the factor 8, and factor 10 activated by factor 9 by calcium. See, first one activation is 12th, then 11th, then 9th. After the 10th will be coming. Yes, so activated factor 10 and involves in the formation of prothrombin activator. Now activation at the same time activation of platelets takes place, that releases phospholipids, also involved in the activation also involved in the prothrombin activator, formation of prothrombin activator. Now extrinsic pathway, if there is any tissue damage, thromboplastin is released. Yes, that thromboplastin in the presence of factor 8 clotting factor, the factor 10 is activated again. Yes, factor 10 is activated, which is involved in the formation of prothrombin activator in the presence of what? Calcium and factor 5. Yes, the prothrombin activator is formed. This is the first stage. And the second stage is what? Prothrombin is converted into thrombin. Yes, prothrombin is activated into thrombin by prothrombin activator. Yes, now this thrombin activates fibrinogen into activated fibrinogen. Yes, activated fibrinogen. This activated fibrinogen is nothing, loose strands of fibrins. Yes, loose strands of fibrin thread Now, these fibrin thread together form a stable clot. Yes, this is the secondary one, the stable clot in the presence of calcium and factor 13. Yes, these are the three stages. What are the three stages? Prothrombin activator, conversion of prothrombin to thrombin, conversion of fibrinogen to activated fibrinogen. Yes, this is the complete discussion of hemostasis. Let me revise once again. Hemostasis is nothing but arrest of bleeding from an injured blood vessel. Yes, the hemostasis is understood under three headings: vasoconstriction, platelet plug formation, and clot formation. Whereas vasoconstriction is a local phenomenon. Yes, it is a transient. It is a local phenomenon, whereas blood vessels constrict immediately after injury to the blood vessels. Now here the platelets releases serotonin. The platelets activated after adhesion to the collagen, they secrete serotonin, which helps in the constriction of the blood vessels. Now platelet plug formation. The platelets secretes ADP and thromboxane A2, which attract more platelets and get aggregated, formation of temporary platelet plug. So that closes the injury of the blood vessel and prevents further bleeding. So the coagulation of the blood is takes place by clotting factors. What is coagulation? Coagulation is the process by which blood loses its fluidity and become a jelly like mass known as clot by 13 clotting factors. Yes, this is complete discussion of hemostasis. If you have any doubt, please comment in the comment section. Like the video, share the video to your friends, subscribe to the channel. Namaste.